Hello, my name is Devt from Devt State Primary School.
Morning, my name is Idris Suleiman, Zonal Project Manager at Devt.
Again, on behalf of the Executive Director, I want to warmly welcome you all to this engagement meeting today. Did I just say Executive Director? Hey, I apologize. Our brand new permanent secretary of the Delta State Primary Health Care Development Agency. So he will be coming in any minute from now. So, but before then, I just want to warmly welcome you on his behalf. This meeting is really important, even at a time like this where some of our partners may be rounding up their projects with us. We need to devise means and ways to make sure that we keep doing what we have been doing to keep up the initiatives as it regards immunization, HPV in particular, because that's what our partners, Girl Effect, have been supporting us with. So I still want to appreciate Girl Effect for all they've been doing for us in the States. We wish that this could continue for longer, but we also have to make plans to make sure that programs and everything still keeps going on, even if the funding from them is coming to an end, so to speak. So it's going to be an interactive session. So I just want to pray for indulgence to follow through with us. Let's see how we can achieve all the set out objectives for this meeting. And as the saying goes, Delta State will carry last. When it comes to our programs, we will not take last in Jesus' name. Thank you.
So once again, my name is Kosi Dundu, and I'm program lead for Girl Effect in Nigeria. I want to start with apologizing for starting this meeting late. It's not particular character of ours, but we are very grateful that everyone is here and has taken time from their busy schedule. I bring you greetings from the country director of Girl Effect in Nigeria, Boladale Akinkolakbo. Should have really loved to be here, but owing to the reason why we are having this meeting also, she's in other engagements trying to get more money, so hopefully we can continue our work here. So thank you very much for taking out the time to be here today. At Girl Effect, we work with 4 girls, and specifically in Delta State over the past 2 years, should I say, because our first engagement with Delta State was in May of 2024 during the launch of the phase 2 of the HPV vaccine introduction in the States. And since then, we've enjoyed very close collaboration with the State Primary Health Care and by extension, the Ministry of Health and Women Affairs, Education and other partners. So we're really very grateful for that very good hand of collaboration we've seen here. And we are hopeful that even as we plan to share our learnings today, that we're able to come up with sustainable strategies. I know the word sustainability has been overflowed. It feels like one of those things you just say now. Exactly. How do we sustain this? Sustainability. But when we understand the concept, we know that sustainability is something we do every day in our lives. It's basically the choice we make between what we do and what we don't do, the choice of what to eat. So if you drink garri today and tomorrow you have eye problem, the way they used to tell us when we were small, it means that we've not sustained the future. But if we decide to drink that garri with other things, it becomes balanced, and in the future we are healthy. So it's simple decisions that way that actually leads to the sustainability that we talk about. So we are hoping that today we are able to leverage some of those resources we have around us that are also cost intensive, right? That don't cost money, things we already have, to be able to sustain the gains we've achieved so far in HPV vaccination for our young girls. I think my colleague at some point today is going to share with us our data, the difference between the baseline, meaning what we met when we came to Delta State and what we are living now that we are going. There's been significant progress, and it's kudos to every single one of us in this room. And yes, please, let's go. Yes. For me, I don't look at the very big fancy things. Every little step is a win, and it's very important that we celebrate those milestones and that we are grateful and proud of them. So wishing us all a very fruitful meeting. I hope that we're able to achieve all our set objectives during this meeting, and that our aim will be achieved at the end. We're going to have a very short presentation just to see all our achievements, what this project was about. I know there's nobody in this room that has not interacted with this project in one way or the other, even if it's just the OYA campaign. I'm sure we've all interacted. So we're just going to see a brief overview of that and also see what the achievement was so far. So basically the name of our project is Accelerate Access to Health Services for Adolescent Girls and Young Women in Nigeria while tackling negative gender norms. And it was implemented under the Devt 5.1 portfolio. And we had 3 broad objectives under one goal, which was to contribute to improved health of adolescent girls and young women in Nigeria by increasing demand for and uptake of priority health services and reducing barriers to access. And under that, the first objective was addressing the barriers and building awareness and acceptance of vaccination with parents and adolescents. We cannot reach adolescents without their parents. And also improving knowledge and access to nutrition products and services. The second objective was under strengthening partnerships for demand for and access to HPV. And the third was promoting learning within the immunization, gender equity, and nutrition sectors for the same. We implemented in 5 states, Delta being one, Ondo, Ekiti, Kaduna, Oyo, and Delta states. And for us, our program was built under an ecosystem which was informed by research. When we first came, like our PS mentioned earlier, we conducted 2 researches. One was the baseline, and the second one, because we're big on media, we conducted a media habits research. The media habits research was basically a research to help us understand the nuances around how our target audiences consume media. So as a young girl who is 9 years old, where would she prefer to get her information from? We would all assume that the typical 9-year-old will want to watch cartoons. But apart from cartoons, there are 9-year-olds who also listen to radio. There are 9-year-olds who also don't have access to social media. But the first thought is also, oh, if she's 9 years old, then she's definitely on TikTok or stealing her mother's phone to do something. So that research actually showed us really what the typical 9-year-old, at the time it was 9 to 14 because we were just introducing the HPV vaccine. So what the typical 9 to 14-year-old consumes and how they prefer their messages delivered to them, as well as their parents across LGAs, and also with the baseline figures. And the results from those 2 researches actually informed this ecosystem, one around our Champions app, where we train teachers and healthcare workers to be able to conduct sessions with parents and girls, parents at the community level and girls in school, to learn more about cervical cancer and the causal virus HPV and how to prevent that. And then we also had social media, where we had various products on different platforms, which was also informed by that research. We had the OYA campaign, which was a semblance of the launch event, where we had recommitments from high-level stakeholders. Outdoor visibility was basically billboards, reinforcing the information, knowing that people are more triggered by what they see, and the more they see, the more they want to know more, and that would actually inform their decision to actually take the vaccine. And then traditional media, where we had jingles, PSAs, we also had radio drama and talk shows. So on the Champions app, in March of 2025, specifically on International Women's Day, we launched the Champions approach. For that, we had a lot of collaboration. For example, in Kaduna State, we literally launched the Champions approach at the palace of one of the chiefs in the community, which actually reinforced that granddaughters, 3 of them, about that age group. And for this, we were able to train 300 champions, and they were mobilized using the Champions app. Sessions around protecting our future, proactive care, overcoming concerns, and advocating for HPV vaccine and nutrition 101. So apart from the sessions, they were also giving curriculums and notes to take back home, which they could always read. Next presentation, we'll see data specific to Delta State. On social media, we had targeted reaching 2.1 million people, but we ended up reaching 4.1 million plus. For our champions train, we targeted training 300 champions, we trained 315. For champion session conducted, we targeted 3,600 sessions. We ended up conducting 7,800 sessions. And for this was mostly due to requests from the states, expanding the reach, ensuring that more schools were benefiting from the champions approach and also communities. So champions had to double up on their efforts to be able to reach where the request was. The girls reached through the champions model. We targeted reaching 6,000 girls, ended up reaching 18,000 girls through the model. Parents through the model also, we targeted 12,000 parents, ended up reaching 32,000 parents. For girls vaccinated through the champions model, you can see we did not have a target for that because the champions model was basically an SBCC, taking the parents and the girls through an SBCC journey for the girls to actually have the agency and understand why they were taking the vaccine. So you don't ask a 9 or 10-year-old, so this vaccine card you have taken vaccine, why? I don't know, they just came to my school to give me. But when they've gone through the champions approach, they're actually able to say, oh, this is why I took the vaccine. My teacher said they taught me that. So we actually did not have that. But as the champions approach began, we saw increased collaboration. In fact, we call it the bestest practice of the project. We saw increased collaboration between the teachers and the healthcare workers to vaccinate the girls. So when the girls go through the sessions, they go back home and advocate to their parents give consent, and then the teachers are able to link up with healthcare workers to either come or they go to the facility with their girls in their cohorts to get vaccinated. So from that process, we were able to reach 26,000 girls and ensure that they were vaccinated. And then for outreach sessions, we had 60 and achieved 61. And for people reached through outreaches, we had over 800K, and this is based on population estimates. And then for girls reached through outreaches, over 60K. We also did not have a target for that. And then for radio, radio was something we did not have a target for because knowing how radio is measured. But however, based on our research also, we were able to get 18 million plus. So that's all for our achievements and for this presentation. I'll be open to taking any questions.
It's better late than never. It would have been very much more better if we had started with you, so that you enjoy, you leverage on our volunteer strength across the state. In all 25 LGAs of the state, we have our presence, we have our Red Cross volunteers, our officers' presence everywhere. Notwithstanding that this is coming to an end, we know if one phase, when we close one phase, another phase will be open. So we are looking forward to partnering with the Girl Effect through the State Primary Healthcare Development Agency in spreading this message and to increase the uptake of vaccination in Delta State. Every child is entitled and has the right to quality vaccine because vaccine prevents so many diseases. And particular reference to HPV, our girl child will be protected. You know, if you must know that we have more girls, more female in the world than men. And that's why the Bible also said that in that day, 7 women shall take hold of one man. But we are getting to that time now. So we need to get our girls safe so that the future will be better for us. So on behalf of the Red Cross, once again, I say thank you for getting us involved, and we look forward to more partnership. My name is Charles Arinomo, the Branch Secretary, Nigerian Red Cross Delta.
My name is Dr. Oyi Owanabuzo, President, Medical Women Association of Nigeria. I want to bring warm greetings from the Medical Women Association of Nigeria, Delta State Branch. We specifically are grateful for this critical meeting that has been set aside. We have been one of the partners during the introduction of the HPV vaccine in the States, and we were so glad to partner with the Delta State's Primary Healthcare Agency for this feat and the success stories thus far. And so it is very pertinent for us to identify those gaps and get solutions in increasing uptake amongst our young girls. And we commit to continue our work in protecting our girls and women from cervical cancer, which is still a leading cause of death among our women and girls. Thank you so much.
My name is Ajia Aminat Jim. I'm the state chair of Devt. Even though the vaccination program came, we did join early, but we are trying our best in our own way to see how we can always engage our Muslim women so that they can be abreast with information on vaccination, HPV awareness, and all that. In fact, we just completed a program that we did some time ago. We invited agency and they came to give us lectures and empower our women on knowledge on how to combat all this kind of HPV. So we thank you very much.
We in FMC Asaba have been actively involved in HPV vaccination. It has been part of our key role in public health, and it's something that is very, very, very key to us. So we go to the schools and we do our routine vaccination for the girl child, you understand? And our CMD has been magnanimous enough to liaise with other bodies apart from the girl effect, and we have this Gardasil and Cervarix which we use for vaccination, you understand? So that is why we are really, really key members in this particular discourse, and that is why we are called, you understand? Because if you come to FMC Asaba and you're talking about HPV, you will always be vaccinated. It's not like they will now tell you that there's shortage, you understand? Maybe in the future, but for the CMD that just came in now, it doesn't seem we will have a shortage of it, because he's a very dynamic person. He's somebody that brings innovation to bear. So we are very key stakeholders, and we should be rest assured if you need us as per continuing the sustainability issue. We are there. Thank you.
Your name again, sir?
Dr. Elusa Moriyeke.
I just want to say a very good warm welcome to all of us. On behalf of UNICEF, we want to commend Delta State government through the Delta State Primary Healthcare Development Agency, like Girl Effect, and all other partners that are here present. We cannot work in silos, so coming together to see how we put together the sustainability plan for HPV moving forward, it's a good one, and UNICEF as an organization will continue to support such process, such initiative, and looking ahead, we want to see how best every girl child in Delta State between the ages of 9 years to 14 can be protected against cervical cancer. So once again, I want to say thank you to the organizers, and God bless us all. Thank you.
Your name again, sir?
Dr. Paul Yukori, recently appointed as permanent secretary. I'm still with the State Primary Care Development Agency. And what we are having here is the closing out ceremony of Girl Effect, an organization that supports health programs. And their area of support focused largely on social mobilization and awareness creation. They came to the state in 2024 when the country had to introduce the human papilloma virus vaccine for curbing the event or in any circumstance where people are vulnerable, especially the girl child who will be vulnerable to cervical cancer. So they came in to support us because the program was new and we were dealing with a new population. And since then, they've not rested. They continue to support the state in that drive to create awareness so that more girls within the target age of 9 years to 14 years came out to receive the vaccine. And they also came up with a media platform, like a youth reporting platform, where people are educated and they need to give feedback. That platform created opportunity for young girls and their parents to discuss, share opinions, share ideas, and also get to us where there are doubts for us to clear those doubts. And they worked so well in Ugeli and one other LGA. They piloted the program there and it yielded a lot of results. Today, the state coverage for the human papilloma virus vaccine has gone up to about 80% from 60% low when we did introduction. Now, it is normal or traditional of any organization that when they start up a project, when they are going to live, the fear of sustaining the program is always there. And so we've also done a sustainability plan with them. And year after year for programs that come, it is only good that those programs are sustained. And so as we do the sustainability plan, usually things that drive it are lessons learned for the period they implement the program. And then we know where we are now, and now we also know what else we need to do to take us to where we want to be. And so today is a good day. We appreciate Girl Effect for what they are doing for us. We also crave the indulgence of other organizations who are also supporting us in this respect to borrow a leaf on what the Girl Effect is doing. This is a good thing for Delta State. And I also want to thank Deltans for living up to expectation, for responding to our clarion calls. And today the state is better for it. But I also want to let us know that the federal government is the chief driver of sustainability. And so since the vaccine came, it has now been routinized, so people can now be rest assured that when you go to our health facilities on appointed days, so long as you're within the target age, you have the vaccine readily available. Thank you.
Okay. So the vaccine, is it a continuous thing, or it has a time frame that it's going to stop, that the primary healthcare centers are going to stop giving it? Does it have a time frame, or it's a continuous process?
That's what I mean by sustainability. Okay. Earlier on, the age bracket to catch a large population, for the introduction, we vaccinated young girls from the age of 9 years to 14 years. Now for the routine phase now, which means that the vaccine is always available now in our health facilities. So any young girl that has grown up to the age of 9 can go to the facilities. Let me also intimate us as part of the sustainability process. We are just looking forward to the federal government increasing the age. So in the nearest future, not so far from now, the government might be also providing opportunity to vaccinate girls above that age.
Okay, so Girl Effect came into Delta State since 2024, and we came in to support the HPV vaccination program. And since then, we've worked closely with the Delta State Primary Healthcare Development Agency to see how we're able to reach 9-year-old girls and their parents to get them to know more about the HPV vaccine, which prevents against cervical cancer, and also getting them to take up the vaccine, because the vaccine is key to ensure that our girls are protected against cervical cancer in the future. So, and that has been a very fruitful relationship. The primary healthcare agency has been very supportive. We've worked closely with them and achieved a lot of results. Out of it is the vaccination of over 26,000 girls, though that's not just in Delta State but across the other 4 states we are working, because we are in 5 states. We've also vaccinated over 60,000 girls through outreaches, and these outreaches has reached over 800,000 girls and their parents in various communities. So as we are closing out, for every project that has a start date also has an end date. So as we are closing out, we are not just leaving the state like that. We are ensuring that our SBCC tools, that is our social and behavioral change communication tools, which are the things we created to share information on HPV throughout the project, are being handed over to the state government for continuity. From onset, we've been working with the state, knowing that a time will come that we'll have to close out the project to ensure that the state is ready and able to take up things when we leave. So with these tools we're handing over to the state will be able to continue the good work and sustain things. And despite the fact that we are leaving, we are always open to support the state. If there are areas maybe the state is working on something, they need our input, our technical support, we are open to support the state. The state is already part of us, and we would always be here to see that the people of Delta State gets the best when it comes to healthcare.